Hi, Dr. Seth Cohen, and today I want to talk to you about penile injection therapy, which is a great option for men in whom the pills just don't seem to be cutting it anymore for their erectile dysfunction. So there are a lot of different types of injections out there. The three that I use are alprostadil, bimix, and trimix. The alprostadil is the only one that's FDA approved for penile injection therapy. They come in different doses, and once again, depending on the severity of the erectile dysfunction, will determine the correct dosage of the alprostadil, bimix, and trimix for that patient, and I tailor it for each patient. There's no sort of cookie cutter diagnostic algorithm. So the patient will get the medication at home when he does, and he's ready to inject himself before sexual activity. Usually it's done about 15 minutes before sexual activity will be engaged. Take an alcohol prep and clean the top of the bottle, which is very important because you don't want to transmit any bacteria to the needle and then to your penis, obviously. So once this is clean, you'll take the top off and pull up the correct amount of medication into the syringe, which I've already told the patient ahead of time so he'll know. Once that medication is in the syringe, taking our trusty prop here, you're going to clean your penis. Very important. You want a very clean site before you're going to place this needle. Even though the needle's clean, you still want to remove any bacteria from the shaft. So it's important to understand your anatomy. When you're holding the penis straight out, you think of it as a clock. The top is 12 o'clock, the bottom is 6 o'clock, then you have 9 o'clock and 3 o'clock. Okay? So I teach my patients to inject at either the 9 o'clock or 3 o'clock spots. That's going to inject it directly into the corporal spaces. You don't want to go at the 12 o'clock because that's where the nerves and the veins are, so that'll be painful. And then you don't want to go at the 6 o'clock because that's where the urethra is. So A, you won't have an erection, and B, you may have some bleeding upon urination. Okay, so once you've marked out your spot, I tell my patients they can go on either side and probably to alternate depending on the day. So let's just go at the 9 o'clock spot. So you're going to clean the area, and then you're going to bury the needle. And I'm going to show you how deep. You want it to the hub. If you don't bury the needle to the hub, then you're basically going to inject the entire medication under the skin, and you've just wasted an injection, and also it'll leave a little bit of a scar there. Okay, so you're going to bury the plunger all the way to the end, so all the medication is into the corpora. Remove the needle, hold a little bit of pressure for a few seconds on that area just so you don't want any blood to come out, and then that's it. Important is to discard all the sharps in a sharps container, so you should have a sharps container at home or wherever you're going to be injecting. And then the erection is going to start to occur within a few minutes. You'll need to have some sexual activity as well to help stimulate additional blood flow. So what should you watch out for? Erections that are lasting very long, more than 4 to 6 hours, you need to call a physician and either he'll refer you to an ER or to his clinic depending on the time of day or weekend, because you'll need to bring your erection down. If you do not, you can cause permanent damage to your penis.